This conference will now be recorded.
All right. So sorry about the delay. My name is Dr. Bhavna Sharma. I work as a medical registrar in NHS London, and this is going to be a small session on OET writing. And what we'll do today is that, keeping in mind the amount of mock tests that we've checked on OET writing, we found certain patterns in mistakes that doctors and nurses make when they're writing their OET letter. The patterns are usually related to very, very basic grammar and paraphrasing mistakes, as well as some mistakes with articles. Mr. Manoj has covered everything separately in the form of tenses to be used on OET writing. How do we form those tenses, the articles that we use before any word, how do we use those articles, how do we use those connectors. That all has been discussed in our previous sessions. What I've done today is now I've tried to look at the medical aspect of it and what I would do or how I would write a letter working in day-to-day life and how those applications can be used on your OET writing. So I've tried, like always, to give you a cheat sheet which you can use on your OET writing. Use that cheat sheet, apply it to your OET writing template, and you should be able to pass quite easily. I try to divide it in between in between sections. So I've tried to divide it by past medical history, present history, how you would write the same in terms of common grammar mistakes that people make, and then examination points, and so on and so forth. So that's going to be the aim of our session. Guys, if you have any questions, please make sure that you type them rather than turn your mic on, because then the whole connection slows down and everybody gets distracted from learning. So type in the questions. Please do not turn your mics on during the course of this session. And if you don't want to appear on YouTube and become a YouTube celebrity, please make sure that your cameras are off as well. Okay, so top mistakes, OET writing, grammar, paraphrasing, and cheat sheet. That's going to be our session today. Starting with how would you introduce yourself on your OET writing? Now, I often find people make mistakes with this. They often make a mistake in between writing that the patient is presenting or the patient presented with, because people get confused as to what tense they would use. Guys, please remember that if you're talking about a visit or one particular visit that the patient has had, that would be in the past. So you're going to write Mr. Johnson first presented and then the date on which Mr. Johnson presented. But if you're writing about a continuous presentation or continuous signs and symptoms which the patient has been attending your practice with, so if you've got a letter which has got multiple visits and each of these visits is about a mental health problem that the patient has been having, that's going to be a continuous tense. So you're going to write, if you're talking about signs and symptoms suggestive of diagnosis and you're starting your letter, you're going to be writing Mr. Johnson has been presenting with or is presenting with. So there have been a number of visits that the patient has come to you with, and the complaints or the signs and symptoms still persist. So you're going to be using a continuous tense. If you're introducing yourself and the patient has been admitted to your hospital with certain complaints, the admission happened in the past, so that's going to be your third sentence. Mr. Johnson was admitted to hospital with complaints of. So the official OET says, the official OET website says that we should avoid the as far as possible. So you can write that Mr. Johnson was admitted, a past tense, to hospital rather than to the hospital with complaints of. Guys, it's never a complaint of, it's always complaints of. So if you're talking about a rash that a patient has developed or a fever that a patient has had, it's always going to be In plural, complaints of. A lot of people make this mistakes. It's a recurrent pattern. So when you're writing about a patient having some signs and symptoms, they're always in plural. So not Mr. Johnson was admitted to hospital with a complaint of or with complaint of. It's always with complaints of. Okay. Now, if you're talking about a certain complaint that a patient has, because I use the term a certain complaint, the complaint is always going to be preceded by a. Okay, so if you're talking about a rash that a patient has, it's going to be a widespread rash. Okay, if a patient has had a cough, you're going to be writing, he also had a bad cough and a fever. Okay. So a lot of students, they get confused as to where do we use a before a disease and where we use the before a disease or where we use nothing before a disease. So if a patient has a certain complaint, which they can get multiple number of times during their life, for example, you can get a rash a lot of times in your life. You're going to be writing a rash. Okay. Guys, this is very, very important. Please make sure that you take a screenshot of this presentation and make lots of notes during this presentation, because all of the doctors and all of the nurses tend to have this pattern of making the same mistake each time on their OET writing. I don't want you to have multiple attempts of your OET writing where you're going to the exam and making the same mistake again and again. So make sure that you take a screenshot of each and every slide on this session. So if someone has a complaint, which they can have only once in their life, okay? For example, if they've had diabetes, you're going to write due to complaints of diabetes or due to complaints of uncontrolled diabetes, because they'll only get one diabetes in their life. So you're not going to be using a or an. But if you've got one particular complaint that the patient has, which they might get a number of times in their life, it's always going to be preceded by a. Okay, so the correct sentence would be, Mr. Johnson visited the clinic. Why have we used the? Because we are talking about a particular clinic that the patient has come to. Visited the clinic due to complaints, so in plural, of a widespread rash over his abdomen. He also had a bad cough and a fever. So Mariam has asked a very good question. She said that we cannot write he presented with a complaint of abdominal pain. No, Mariam, never ever write that. That's completely not acceptable. You're going to be writing he presented with complaints of abdominal pain. Okay, you don't have a single complaint. Oh, I had an abdominal pain at 6 a.m. today. The abdominal pain persists and you keep complaining because of the abdominal pain. So it's going to be he presented with complaints of abdominal pain. Remember, Mariam, we're not going to be writing abdominal pain, okay? Because it's one particular type of pain that we're talking about. If it was a rash, which you can get one rash or multiple rash, one cough or multiple episodes of cough, with abdominal pain, you never precede that with a. Okay, so Mariam, if you've understood that, please type in yes. This is a very, very common mistake that everyone makes on their OET writing. And from now on, no one is going to make that mistake, at least the people who are attending this session. Okay, so that's your introduction to the common mistakes that people make are where they write presented and presenting. The second mistake they make is to the hospital. The third mistake is complaints of. And the fourth mistake is a cough or a fever. Guys, if you've understood the four mistakes that people make and how you're going to prevent those mistakes on your OET writing from now on, please type in yes and then we can move on. Excellent. So those were the mistakes that people make on introduction. Now let's move on. Now, the second thing that I want to discuss is the history of presenting complaint. So your patient will always come in with one specific complaint which is going to trigger that referral. Okay, so the patient might be coming to the GP practice for a number of times with mental health issues, and one particular visit where they became acopic, or they weren't able to cope with their symptoms, or they perhaps had a suicidal ideation. That's going to be the trigger for referral to a psychiatrist or a psychologist. So the main complaints that they had are going to be the presenting complaint. So that's going to be something that you're always going to be including either in your introduction paragraph or in your first history paragraph. Okay, so very, very important when you're assessed on your purpose. The presenting complaint is the thing which made you to make that referral, or which prompted you to make that referral. So guys, this is also a common mistake that people make. Always include the first or the most important complaint either in your introduction or in your first history paragraph. Now, the ways that we can talk about presenting complaints is that you can say either the patient reported or the patient stated. So those are two vocabulary points which you can get if you write. So you've introduced the topic already. Mr. Johnson first presented to our clinic with complaints of intermittent abdominal pain. He reported that he had central abdominal pain. Okay, so the presenting complaint is present at the time that you're taking the history. Okay, so that's why you're going to be using a simple past tense. So he reported that he had central abdominal pain, which was described as. So when you're talking about the patient describing a pain, you can use that particular phrase very well, which was described as severe. Okay, sometimes they talk about the intensity of pain. How can you paraphrase that? You can write, or rated by him as 10 out of 10 in intensity. Okay, if the patient starts talking about associations of the pain, that's again going to be in past tense, because the associations were there when you were taking the history of this patient. So you're going to write, the pain was associated with nausea and vomiting. Okay, if the patient then talks about them having an associated symptom along with the pain, or something which accompanied the pain, you can write was associated with something, or you can also write, he also reported a metallic taste in his mouth along with the pain. So along with is also a good method of writing about association of symptoms. Okay, remember the tense that we're using here, guys. It's very, very important. Now, the patient, you can also write, if we're talking about radiation of pain, so radiation, we always write radiated to. Okay, you can also write into, so the pain radiated into his legs, but a better way is to write radiated to his leg. So he also stated that the pain radiated to his back, not radiated in, not radiated at, it's always radiated to or radiated into, and was sharp and shooting in nature. So if the patient is describing the pain in certain ways, then you're going to write, he described the pain as if a elephant was sitting on top of his tummy. So if the patient is describing a pain in certain words which aren't really proper English, what you can do is that you can write that the patient described the pain as, in quotes, something sitting on top of his chest. Okay, because it's a abnormal phrase to use, you can use the in quotes method, which is basically whenever you're quoting the patient. Quoting means that you're using the patient's words. That can often happen on your OET, that they say that the patient reports pain as something sitting on top of his chest. So you're going to write the patient reported the pain as, and you're going to put in the in quotes, something sitting on top of his chest. Ashwarya, yes, we write radiating to his leg or radiating into his legs. Manpreet, I didn't really get your question. You've written, can we use to and in one sentence? Can you please just elaborate on that so that we can answer that? Okay. Before we wait for Manpreet to evaluate or to elaborate, the next sentence would be, if the patient is talking about them trying certain treatments and that not working for their symptom, you can write, he stated that his pain did not respond to over-the-counter analgesics. He did report that the patient, that the pain felt better with hot water bottles. So you will write did report when the first sentence is a bit different than your second sentence. Okay, for example, the patient said that the pain was severe. He did report that it did not interfere with his daily activities. So there's a difference in between the patient telling one symptom and then another statement about the symptom, which is a bit different. So Manpreet has said that can we do one in two sentences? For example, he also stated that the pain radiated to his back and was sharp or shooting in nature. So Manpreet, you can either split that into two. You can say that he stated that the pain radiated to his back, full stop. The pain was sharp and shooting in nature. Or you can write, he stated that the pain radiated to his back and was sharp and shooting in nature. Some people, they don't like to use the term and two times, which is, I think, something which might be driving your confusion here. So if you're not comfortable with that, you can write, and the pain was sharp or shooting in radiation. So if you don't want to use and two times, you should be able to use sharp or shooting, because we're not really using two ands then. So Benita has asked, can we use, he reported also that the pain radiates to his legs? You can write that, Benita, but I would prefer that you write, he also reported, not reported also, he also reported that the pain radiated to his legs, because we're using two tenses. So I would rather prefer you writing radiated, but if you write radiates, that is also correct. Tabuya has given us a very good method of writing this. She said that, is it correct to say that the patient verbalized that the pain radiated, Tabuya, to the back, to his back would be a little better, and was sharp. Okay, because guys, what I would prefer is that you keep your history of presenting complaints in the past. Okay, because remember, the history of presenting complaints was valid when you were taking the history. Okay, so always, if you want to just stop the confusion and stop with all the noise in the background, just use your past tense, and that's just going to make your life easy. So Tabuya, if you write that the patient verbalized that the pain radiated to his back and was sharp. Okay, that's a little bit better. just memorize that history of presenting complaints, we're going to be using the past tense. So Amala has said, is it okay with the last sentence? So Amala, when you're asking that question, because you're talking about a particular last sentence, Amala, please ask that question with, is it okay with the last sentence, comma, we can say, however, he felt comfortable with hot baths. Amala, you need to tell them that the pain did respond to the hot water bottles. So if you just want to write felt comfortable, you should write he felt more comfortable with hot packs, because we're talking about something improving. Okay, so felt comfortable won't really tell me that the pain actually improved. Therefore, Amala, if you write he felt more comfortable, that's a better sentence. Okay, so Amala, if you've understood that, please type in yes. Okay, so that was the history of presenting complaints. We're going to make our life very, very easy, and we're going to be using the past tense. So Yash is asked, that means when we write a letter during our exam, we simply can proceed with past tense in presenting history. Yes, because Yash, when I say presenting history, I'm talking about only the history of presenting complaints. This is going to change when we talk about the medications and when we talk about uh, the past history that the patient has. So keep that in mind, Yash, that we're only be going to be using history of presenting complaints in past tense. Rest of it might change. Okay, so guys, if you've understood what tense we're going to be using in history of presenting complaints and how we're going to be describing the patient's complaints, please type in yes, and then we can move on. So Zanir has said, can we also say that the pain was alleviated by the use of the heat pack? Zanil, we're talking about heat packs in general. We're not talking about one particular heat pack or one particular brand of a heat pack. So what you're going to say or what you're going to write is the pain was alleviated by the use of heat packs. That's going to be in plural, and there's not going to be a the before heat pack, because we're talking about heat packs in general. So Daniel, if you've understood that, please type in yes. If you're making that mistake here, probably you're going to be making that mistake in your exam as well. Guys, when you're talking about things in general, there's never a the. When you're talking about something in particular, there's going to be a the. So Mr. Manuj did cover that in our session on articles in OET writing. If you're still confused regarding that, please go to our YouTube channel, Teach Your Academy, and please go through that lecture. That's going to be solving a lot of your confusions. Jetwa, we're going to be discussing where we're using has had. Okay, so hold on to your horses. We're going to be discussing that in the next one. But what I want you to know is that history of presenting complaints is going to be in your past tense. Okay, we're going to be using has had in the next slides, so hold on to your horses. Okay, so Jedwa's answer is now done. So if you're talking about past history, something that the patient has had or the patient has been having that problem and the problem still persists, okay, that's where you're going to be using has had. All right, so Mr. Johnson has had diabetes for the or since the past 20 years. He reports that his diabetes is well controlled. So the diabetes has been there for a long period of time, and that's why you're using has had. Okay, another way that you can write is Mr. Johnson has had three heart attacks in the past. So has had, because that has happened in the past and he had a heart attack, so that heart attack didn't really correct itself. So has had. Now there's a difference. If you've had something which still persists, then a better way is to write has had. But if you've had something as a particular event and that event stopped or that event was isolated, then you write had. Okay. For example, in 2009, Mr. Johnson had a right middle cerebral artery stroke and now has residual paralysis. So the stroke was an event, an isolated event which happened, okay, because it was a particular type of stroke, and the residual paralysis is something which he has in the present. So that's why I'm going to be using the present tense here and the simple past tense before. Guys, if you've understood that subtle point as to why the diabetes was has had, the middle cerebral artery stroke was had, and the residual paralysis was has, please type in yes, because this is a very, very, very important concept that you do need to know on your OET writing. So, okay, so Karez has asked me to repeat that. So we're going to be doing that because Karez, it's a very, very important concept that you need to understand. So if you have a disease which persists or is a chronic disease, for example, hypertension and diabetes, okay, and ischemic cardiac disease or heart failure. So those diseases never go away, okay, they're always going to persist. So in those cases, you're going to be writing has had because the disease still persists at the time where you're writing about the patient's past medical history. If someone has a stroke, sometimes the stroke can recover. The stroke isn't, so the paralysis or the weakness that you get from a stroke might persist, but the event of a stroke is one. Okay, so it's a single stroke that you have, and then you might recover from that stroke or you might not recover from that stroke. And that's why, because it's an isolated event that happened in the past, which may or may not be persisting right now, that's why it's a simple past tense. Okay, but if you had a stroke in the past, which was simple past, and they have now developed some symptoms which are now the present for the patient, that's going to be a present tense. Okay, so in this example, the patient had a right middle cerebral artery stroke, so that's done. That was an isolated event and that was in the past and it stopped now. And the residual paralysis is something that the patient still has, so that's why I'm using a has there. The diabetes has been there for the past 20 years. So that's why it's has had diabetes. Okay, because the diabetes still persists. Now there's an exception to this, which is the second line. Has had 3 heart attacks in the past. If you've had multiple things, multiple events of the same thing, like the 3 heart attacks that the patient has, you're going to write Mr. Johnson has had 3 heart attacks in the past, or Mr. Johnson has had 3 strokes in the past. Okay, because there are multiple events of the same thing. Then you can use has had. Otherwise, as a rule, if a disease still persists or it's a chronic disease, it's has had. So those are going to be your diabetes, hypertension, heart failure. If there's an isolated disease that the patient had and the disease then stopped. For example, a stroke, which they recovered from, a respiratory tract infection, or a pneumonia, then that's going to be Mr. Johnson. In 2009, Mr. Johnson had a episode of pneumonia. Okay. So guys, if you've understood that, please type in yes. So Yash is asked, can we write Mr. Johnson has been suffering from diabetes for the past? Yash, it's always the past. Guys, this is also a very common mistake. I'm glad that Yash has highlighted that. Whenever you're writing about a particular time period, you're always going to precede that with the. So Mr. Johnson has had diabetes since, you can write for as well, nothing wrong with that, but since is a little bit better because it signifies a continuous period of time persisting up to the time where you're writing this letter. Since the past 20 years. Okay, so it's always a the there. So Yash, make sure you don't make that mistake in the future. So Mr. Johnson has been suffering from diabetes for the past 20 years and he mentions that it is well controlled. Okay, so Yash, you're going to write Mr. Johnson has been suffering from diabetes. So the thing about suffering is, we discussed it in previous sessions as well. The OET doesn't really want you to write the term suffering a lot because that's just something that the official OET guidelines have told us, that try and avoid suffering as far as possible, especially when you're talking about diseases which you can control like diabetes and hypertension. If you're talking about cancer, which the patient might die from, suffering is better. But otherwise, the official OET guidelines tell you to avoid suffering as far as possible. So, Yash, in that case, you can write, Mr. Johnson has been diagnosed with diabetes since the past 20 years and he mentions that it is well controlled. So, just avoid suffering as far as you can. Amala, again, try to avoid the term suffering. So since the last 15 years. So always the Amala. Remember guys, when you're talking about a time period, it's always the. Just memorize that. It's very, very important. So Amala, if you've noted down the mistake that you made, please type in yes, no using suffering and always preceding with a the. Okay. Now that we were talking about and the, and we talked about it quite a lot, notice the difference in between the two sentences here. Mr. Johnson is being followed up at a diabetes specialist clinic versus the second part. Mr. Johnson is being followed up at the Hartford specialist clinic. Guys, if you understood the difference in between those two, please type in yes. Otherwise, we'll move on. Why have we used a here and why have we used the? So it's only Mariam who's understood that. Guys, if you don't understand that, please let me know and then I'll explain. So Ikram has very correctly said the is because it's for a specific clinic. Okay. So Manpreet, you can have a number of diabetes specialist clinics. Okay. So just because they've said that they're getting followed up at a diabetes specialist clinic, that means that they might be followed up at any diabetes specialist clinic. They're not talking about a particular or one diabetes clinic. But in the second example, there's a name provided. It's the Hartford Diabetes Specialist Clinic. Because now we're talking about one particular diabetes clinic or one specific clinic by the name of Hartford Diabetes Specialist Clinic. That's why in the first example we've used a, and in the second one we've used the. So if you've understood Zanil and Manpreet, please type in yes. Another thing you might notice about this sentence is that we've used is being. Okay, so why have we used is being? Because the thing is still happening, so it's continuous. Okay, is being followed up at a diabetes clinic, or is being followed up at the, because the thing, the follow-up is still happening. Okay, so Yash has very correctly said is being means that he is still doing this. So the thing is still happening. That's why it's present continuous. Ikram has asked, can we write that Mr. Johnson has been followed up instead of is being followed up? So Ikram, the thing is still happening. Okay. First of all, the way that you've written B-E-I-N-G, that's incorrect if you're using that with has. Okay. It should be Mr. Johnson has been, B-E-E-N. Okay. So Mr. Johnson has been followed up, but what that means is, guys, let me just put up a question for the audience. Do you recognize the difference between Mr. Johnson has been followed up and is being followed up? Okay. If you recognize the difference in between the two, please tell me, why do you think that's different? How is Mr. Johnson has been followed up at a diabetes clinic different from is being followed up? So Zanil and Usman are correct. One is current. So is being followed up, that means he is currently being followed up. Has been followed up means that was followed up. So that's in the past. Okay. So very, very good, guys. Guys, can we make sure everybody's mics are off during the course of this session? Manpreet, please make sure that your mic is off. All right, good. So very good, Benita, Ikram, and Yash. So has been followed up means he not, so Yash, you've said visited once. It could be that he had multiple visits. It just means that he had in the past been followed up. Okay, so if you're currently being followed up, that's going to be is being. If you were followed up in the past, it was has been. Good. So good job, Tabuya and Ibe. All right. Now, sometimes you can write past medical history as is known to have hypertension. Instead of writing has had diabetes, you can write is known to have. That means that they still have that complaint, and the complaint persists. So another way of writing has had is known to have hypertension and ischemic heart disease. Usman, I would avoid the term is a known patient of, because patient, you know, the way that we're taught medicine is that we should avoid terms like suffering and patient of, because that basically puts the patient in a vulnerable spot. It's very, very advanced ethics, but for your OET, Usman, never write patient of and never write suffering. Okay, it's just that when you become a little more senior, or perhaps you're already quite senior, when you come and work in the UK or work in Australia, we tend to put the patient at a higher spot or at a higher level of position, and we tend not to be condescending to the patient. So using terms which victimize the patient, this is again going quite beyond your OET. This is something that I just want to emphasize on now that we're talking about writing or referring to patients, especially when you come and work in the UK. We try to not make the patient appear like a victim as far as we can. Okay, So calling them a patient of or saying that they're suffering from are going to put them in a vulnerable position. You want to be as respectful of the patient as possible. So avoid using terms like a patient of and has been suffering from, because that's just a little bit impolite for the patient. So Usman, if you've understood that, that's a very subtle point. If you've understood that, please type in yes. That's fine, Usman. When you become old like me, you'll probably start understanding these things better, how you're supposed to be. A little, you're supposed to put the patient on a higher ground than you. So, Dr. Zenil has asked, is it necessary to use since and for with has been? So, what do you mean by has been? So, whenever you're describing a particular thing that the patient has, there has to be a possession. So, has been diagnosed with, because the patient ha has something. So, you always have to have a possession with that or a possessive connector with that. So, that's going to be with. And then you've asked since and for. So yes, you tend to have to use if they haven't given you a duration of the diabetes that the patient has had, then you can write Mr. Johnson is known to have diabetes. That's a little bit better when you don't have a duration. When you write Mr. Johnson has had diabetes and full stop, that sounds a little bit awkward and a little bit wrong. So you can write Mr. Johnson is known to have hypertension, known to have diabetes, or Mr. Johnson has been diagnosed with diabetes. So Dr. Hijab has said she has been diagnosed with diabetes since 2003. So that's correct, Dr. Hijab. Remember, guys, if you have a year, you will not write the, okay? So you will not write she has been diagnosed with diabetes since the 2003. The is only going to be used when you're talking about a time period, because you're talking about a specific time period, which was of 20 years. That's why we're using the past 20 years. But if you're talking about 1 year, then that's going to be since 2003. Very, very important that we remember this. So the points and the mistakes that we make in past medical history are going to be has had, since the past, that's another mistake, at the, and is being and has been. Manpreet, that's also correct. Okay, that is your past history. Guys, if you've understood the mistakes that people make and what you're not going to make in the future, please type in yes, and then we'll move on to our next points. Okay, social history. Social history, we're going to be using the present tense. Okay, why? Because the patient still has that social history. Okay, a lot of people, they struggle with this, especially when they're talking about smoking history. You can write if a patient is currently smoking, a good way to write that, and perhaps this is a very common history which does pop up in your OET quite a lot, is when the patient is an active smoker. You can write that as Mr. Johnson is an active smoker and smokes 5 cigarettes per day since the past 40 years. Or if you're talking about pack year history, you can write he has a 40 pack year history of smoking. Ra, it's okay to write he smokes heavily, but I would be a little careful about that, because lots of people, they get confused about what counts as a heavy smoker versus a non-heavy smoker, because that's quite medical. So if a patient definitely has a very, very significant smoking history, like 50 pack years, or they smoke 10 cigarettes per day, then it's okay to write smokes heavily. But if they smoke 1 to 2 cigarettes per day, that's not actually heavy smoking. So I would be a little careful about writing he smokes heavily. Make your life a little easy. Just write is an active smoker so that you don't have to make that decision whether it's heavy or not. So Yash is asked, Mr. Johnson is an active smoker and has been smoking 5 cigarettes per day for the past 40 years. That's fine. Manpreet has asked, can he write around 5 cigarettes? You can write that, Manpreet, around should be fine. But sometimes smokers are quite specific as to the amount of cigarettes they smoke. So even if you write 5 cigarettes per day, that's fine. Around 5 cigarettes is also fine. Ikram has asked, how should we write this if he's not an active smoker? Ikram, you can write that Mr. Johnson does not smoke or is not a active smoker. So again, is, always using the present tense. That's also fine, Diksha. So Usman, I can't really see your, what you, Usman has asked means we have to be specific. Usman, I didn't really understand that question. If you can just elaborate on that, that would be quite helpful. Zenita has said for over 40 years. That's also completely fine. So you're going to write, Mr. Johnson is an active smoker and smokes 5 cigarettes per day over the past 40. So when you're writing over, it might become a little difficult because then the correct English word would be that he smokes 5 cigarettes, has been smoking 5 cigarettes per day over the past 40 years, because the thing that we're describing has been happening over that time period. Okay, then the tense will change. So Benita, just be a little careful. I would avoid the term over, because then the whole rules will change. Then you would have to write, and has been smoking 5 cigarettes per day over 40 years. Okay, so Benita, avoid over. Zenir, both are correct. So since means the time period started and it's still happening. For means we're talking about a particular time period. Okay. Since has a start, for is a duration. So both of them are fine. Benita, avoid over. Okay. Do we, Amala, do we write? Not do we can write. Do we write? He has a habit of smoking. I would tend to avoid a habit of smoking because it's an impolite way or an informal way of writing this. So an active smoker is the best way that you can write this. Okay. So Zanil and Amala, if you've understood that, please type in yes. eBay has asked, can a binge drinker be described as an active drinker? eBay, this is again going a little medical. Binge drinking is different from active drinking. Binge drinking means that the patient or the person doesn't drink for a particular period of time. For example, they don't drink over 3-4 days, and then over the weekend or for one particular period they drink quite a lot, and then they stop drinking for 3-4 days, and then they drink quite a lot. So that's what is the definition of binge drinking. So avoid that, avoid binge drinker because it means something different. Active drinker is also wrong. Drinker, I would avoid that word. Smoker is fine. Drinker, because you don't really know what they're drinking. I would rather write, Mr. Johnson has a significant alcohol history rather than active drinker. Avoid drinker as much as you can. Usman, about the number of cigarettes, if you want to calculate the pack years, then that's fine, but that's again quite medical. If on your OET case notes, they've specified the number of cigarettes that they smoke, then you can give the specific number of cigarettes. That's fine. Hijab, I would tend to avoid the term alcoholic as far as possible. Why? Because alcoholic is the diagnosis, and if you remember medical school, you need to have certain criteria fulfilled for a person to be classified as an alcoholic. And on the OET, they might think that you're sounding quite impolite to the patient. So write it as Mr. Johnson has a significant alcohol history rather than saying that Mr. Johnson is an alcoholic. A lot of people make that mistake, and I often pull them up for this. Avoid the term alcoholic on OET letters and even in real life. Dr. Azhar has asked how to say when he has quitted recently. Dr. Azhar, when he has quit recently. Okay, never quitted. You can say that Mr. Johnson has recently stopped smoking. Again, we're using the present tense, has recently stopped, because it happened in the past. Has stopped recently. So Amala has asked, if the patient has number of substance being abused, then how can we write? So you can use the fourth sentence. You can say, Mr. Johnson abuses cocaine and heroin regularly. Okay. So if you're talking about drugs, you can use the term abuse because it's always drug abuse. When you're talking about smoking, you never write abuses smoking or abuses alcohol. You should write abuses when you're talking about drug abuse. Okay. So Mr. Johnson abuses unknown amounts of cocaine and heroin regularly. No, Dr. Hijab, we will never write alcoholic. Manpreet, you can write I mean, it's a bit difficult whether you want to mention the brand. If they're talking about alcohol and they're talking a lot about alcohol, perhaps the reason why they're doing that is that OET wants you to cut out the irrelevant history. So if they've specified that the patient only drinks vodka, then you can say that Mr. Johnson has a significant alcohol history of mainly vodka. But if they're talking about vodka, beer, spirits, whiskey, lots of things mentioned, perhaps the OET wants you to condense that, and then you write just Mr. Johnson has a significant alcohol history of various types of alcohol. When you're talking about someone having a significant alcohol history, you usually have to say off. So has a significant alcohol history of. So Usman, abstain. So what abstain means is that you keep away from something. Okay. Abstain is generally a process. Okay. Now again, this is a little more medical. Abstain is, if you abstain from smoking, means that you keep away from smoking, and it's usually continuous, that he has been abstaining from smoking. So he hasn't really quit, but he's abstaining. Abstaining is that you try and stop yourself from doing something, but you haven't really stopped it completely. Okay. So if your patient is trying to quit smoking, then you can write that the patient has recently started abstaining from smoking. But if they've quit smoking completely, then you write has recently quit smoking. So you never quit from smoking, you quit smoking, but you abstain from smoking or abstain from cocaine. Rachel, I would say abuses cocaine rather than consumes cocaine, because drug abuse, generally the term that we use when somebody uses drugs is abuse. So that's the correct English or the most commonly used English word with drugs. That's abuse. So that would be the verb that I would use. All right. So that was social history, guys. One last thing that I want to just mention about social history is that if someone has a particular social situation and it still persists, another way of writing that is currently. So Mr. Johnson is currently smoking. Mr. Johnson is currently smoking. All right. So guys, if you've understood everything about social history, the tenses that we use in social history, the way that we write about smoking, alcohol, and drugs, please type in yes, and then we'll move on. Excellent. Okay. Now let's talk about examination. Remember, the examination that we're mentioning on your OET letter is in the past. So you examined the patient in the past. So all of the examination findings are going to be in the past. Okay. Because when you took the temperature of the patient, that was a particular point in the past. And perhaps they don't have that temperature anymore. And it wasn't something that they were having for a long time. You examined their temperature, it was found to be 38 and it was a single point. So that's why simple present. Okay. So the way that you write that is, at the time of examination, Mr. Johnson had a temperature. Not has a temperature, not has had a temperature. It's going to be had a temperature. Okay. So had a temperature of 38. So whenever somebody has a temperature, the temperature is off. Okay. So had a temperature of 38 degrees Celsius and a pulse rate of 109 beats per minute. So just pay attention to us writing off when we're describing vitals. Guys, remember, when you're talking about heart rates, or when you're talking about pulse rates, please make sure that you expand it. Never you will never write PR of 109 BPM. You're going to be writing and a pulse rate of 109 beats per minute. We're writing as well. Just have a look at that. A temperature of, a pulse rate of. Very, very important points which everyone makes a mistake in OET writing. Just going back to the previous slide, Ra has asked, is it necessary to write Mr. Johnson is living with his wife and kids? Ra, mostly social history. If you go back to our previous sessions, I've talked about irrelevant and relevant history, and where a person living with his wife and kids might become important. If you go to our previous session on difficult referrals, I've explained that before. So you will write that only if it's relevant to your audience. Mariam, yes, because the examination findings were at a single point in the past. That's why at the time of examination, Mr. Johnson had a temperature, because when the person received the letter, the examination has become the past. No, Dr. Hijab, I would avoid using BD and TDS. Thrice a day, twice a day should be better. Okay, very good. Signs. When you're talking about signs, you always use a passive voice. You never write, I found the patient to have abdominal tenderness, or I examined the patient. You always write a passive voice. You can go back to our lectures on our YouTube channel for the difference between active and passive voice. Zaril, you can write an elevated temperature. But just pay attention, guys. Zenil has written an elevated temperature. Why? Because it's an E. So not a elevated temperature, an elevated temperature. Okay. At the time of examination, Mr. Johnson was found to have abdominal tenderness in the right upper quadrant. He also had right-sided basal chest course crepitations. His neurological examination revealed no new signs. So always the passive voice. Amala, you can write was experiencing abdominal pain. Ikram, yes, we can write revealed, that's fine. But when you're talking about vitals, this cheat sheet might be a little better for you, especially if you struggle with a and the. Guys, if you just take a screenshot of this and you use this at the time of examination, had a temperature and a pulse rate, this is quite useful. But remember, guys, you will include only the examination points which are relevant to your audience. This has been discussed in the past. So if you go to our YouTube channel, you should be able to differentiate between what is relevant and what is irrelevant history. Okay. So guys, if you've understood the concept of the common points that people mess up on their examination when they're talking about examination on OET writing, please type in yes and then we can move on. Excellent. Now, again, the investigations, because the investigations were at a particular period of time, you're going to be using the past tense. And it's always a passive voice. On his blood investigations, Mr. Johnson was found to have a low hemoglobin. Guys, remember, a low hemoglobin, a high pulse rate, and an increased white cell count. Very, very important. You pay attention to where we're using these articles. A low hemoglobin, an increased white cell count, a low heart rate. His C-reactive protein was found to be markedly raised. When you're talking about an investigation which is very, very abnormal, you can use that phrase, was found to be markedly raised. It was also noted that he had significantly reduced albumin levels. So when you're talking about something being very, very raised, you can write markedly raised, or when something is quite reduced, then you can write significantly reduced. But the tense that we're using is past. Now, there's an exception. In the previous two examples, we use the past simple tense in passive voice. But in the third example, we've used in the fourth example, we've used continuous tense because we're talking about an investigation over a period of time. Okay, so that's why you're going to be writing his renal function has been deteriorating. Okay, because we're talking about renal function over a period of time rather than one particular renal function at one particular point in the past. We're talking about renal function over a period of time. That's why we're going to be writing his renal function has been deteriorating since the past few months. Since the past few months. Compared to his previous reports, no new changes were noted on his head CT. Dr. Hijab, you should write his MRI indicated because the MRI happened in the past. It indicated something in the past. You should write indicated. You can write his MRI indicates, but just for the purpose of OET writing and following the guidelines because the MRI happened in the past. Another MRI might have happened in the future. His MRI done on 20th of October 2019 indicated or revealed hijab, the ECG changes at every point. Okay, so even though the MRI might be a continuous report, you can never write ECG detects. The ECG detected at the time of investigation, the ECG revealed, not reveals, because the ECG changes each time. So even if you write MRI indicates, it's fine because that's a larger investigation. But ECG, because it changes, a patient's ECG might vary from 1 minute to another. The time that you did that ECG, it detected something or it revealed something. That's why it's in the past. Okay. So the mistakes that people make is not using the past tense, not using complete full forms, and the and when they're using it. So guys, you can take a screenshot of this and you can apply all of these points to your future OET writing, and that might be extremely useful. All right. Guys, if you are interested, whenever you send us the OET writing letter, we always get it assessed by a doctor as well as an English teacher so that all of these points are covered. So if any of you are interested in OET writing or OET speaking, our feedback will cover all of these things and why we're using each thing at each point. So visit our channel www.teachacademy.com to enroll in our writing and speaking check. That might be quite useful. Usman, for things like MRI and CT and X-ray, you don't need to use, and even ECG sometimes, you don't need to use full forms. But for things like CRP, white cell count, hemoglobin, you use full forms. Okay, guys, if you've understood all of these things about investigations and the common mistakes, please type in yes, and then we can move on. Excellent. Now, medications, quite important on your OET writing because a lot of things can happen with your medications. One is that you're talking about medications that the patient is on and that you've not really changed. In that case, your life is quite easy. You use the simple present tense. So, Mr. Johnson is currently on metformin and gliclazide for his diabetes. That's simple. The patient came on these medications. You did nothing to these medications. So this is simple present. Then if something changed during this medication, for example, you added a new medication to this patient, then you write, Mr. Johnson has been prescribed metformin during this admission. Okay, because the prescription happened during the course of this admission, so there was an admission period, and some point in between this admission the patient was prescribed metformin and the patient still remains on metformin. That's why you're going to be writing, Mr. Johnson has been prescribed metformin during this admission. Okay, so this is when something was prescribed during the patient was with you. Now, sometimes what can happen is that you withheld a patient's medication or you changed a patient's medication. In that case, the medication was prescribed in the past. So, Mr. Johnson was prescribed metformin by the endocrinologist, which has now been withheld because the medication being withheld still persists. That's why it has now been withheld. But the prescription was in the past. That's why was prescribed. Now, the patient has been on a medication for a period of time. So, Mr. Johnson had been on metformin for the past 13 years, because him being on metformin was over 13 years, had been on metformin for 13 years, which was stopped during the admission. So, at a particular point during the admission, it was stopped. So, simple past. So Ra has asked, during admission, hospital has increased the medication. So then you write, Mr. Johnson Mr. Johnson was prescribed metformin by his GP, which was increased during his hospital admission, or which has been increased during this admission. All right. So instead of prescribed, you can write Mr. Johnson has had an increase in metformin during this admission. So Dr. Hijab, you would use commenced on. So Mr. Johnson has been commenced on metformin. Okay, so he has been started on metformin. Commenced is just like an alternative of started. Okay, so Mr. Johnson's metformin was commenced, or Mr. Johnson's metformin was started, and Mr. Johnson was started on metformin. Mr. Johnson was commenced on metformin. So it's just an alternative to start. Yes, you can write was prescribed. So remember, but the better way is has been prescribed, because the prescription still continues, but was prescribed is also fine. Yes, Tabuya, that's fine. Mr. Johnson's metformin dose was increased during his admission, or you can write Mr. Johnson's metformin dose has been increased during this admission. So Rachel, you should mention doses when you've changed something, or when you've started a new medication. That's when doses become important. But if a patient has been on a particular medication for a long period of time, you've not really changed it, and you're referring this patient back to the patient's regular care because nothing has been changed, there's no need to mention the medications or even mention the doses. All right, so guys, if you've understood the way that we write various types of medication and various types of medication changes on the OET, please type in yes. User, no, you cannot write is being prescribed. Okay, the prescription isn't still happening. The prescription has happened, has been prescribed. Okay, is being prescribed is like your doctor is still writing that prescription. The prescription has happened and the prescription still persists, so has been prescribed. Whereas we've discussed relevant and irrelevant history in our previous sessions. So if you go to our YouTube channel, it's by the same name as Teach Your Academy. You should be able to find out where we would include certain histories and where we would exclude it. Similarly, Ashwarya has written, can we write his current medication list includes? That's fine. Or you can also write his current medications include. So if you're writing current medication list, so that's a single word, medication. But if you're writing current medications, that's going to be a plural. Okay. All right, moving on. Now, things might change during the course of the hospital admission. So you can write course of illness. So the patient's illness might get better or it might get worse. So you can write, with regular use of insulin, Mr. Johnson has had an improvement. So the improvement still persists. That's why it's going to be has had. Or, despite multiple doses of opioids, Mr. Johnson has not had any improvement in his pain. So if the thing worked, then you can write with. If the thing didn't work, then you can write despite. But the tense that we're using when things are improving or they're getting worse are going to be has had or has not had. Okay. So this is how we talk about the course of illness. So Dr. Hijab, what I mean to say is that during the course of illness, your things, during the course of the hospital admission or during the course of the patient being ill, things can improve or they can get worse. Okay. Because the improvement still persists or the improvement doesn't persist, then you can write. All right, we've just lost the connection. Just going to pull it back. Guys, we're just getting the screen on. All right, while we're waiting for the screen to come back, remember, when we're talking about some improvement or something not improving, the changes still persist at the time where you're writing the letter. So that's why the tense that we're using is has had. Okay. So Zanil has asked, due to the use of regular insulin, that's fine, Zanil. Yash, I didn't really understand your question. So if you can just repeat or elaborate on what you want to ask. And Hijab, if you've understood the point, please type in yes. So despite is that the first thing didn't help the second thing. So that's why we're using despite. With is because the first thing helped the second thing happen. So that's why we use with. So that's things which join each other, and the second thing is things which oppose each other. All right. Guys, if you've understood the things about course of illness, please type in yes. So Dr. Usman has asked, we have to start with medications he responded to and then the things he didn't respond to. Usman, it doesn't really matter. Yash is asked, with regular use of insulin, Mr. Johnson, Yash, J has to be capital. Mr. Johnson's HbA1c levels have shown an improvement because the levels are plural. That's why it's not has, it's have. Guys, these are very subtle points and what everyone makes a mistake in. So HbA1c levels have shown an improvement. In addition, comma, his pain score has also showed a good progress after using codeine and omeprazole on a daily basis. So it's always on a daily basis, and Mr. Johnson has to be capital, and in addition you have to put a comma and its HbA1c levels have. Okay. All right. Moving on. The last thing, the follow-up plan. Now guys, remember, the follow-up plan is something which is now going to happen in the future. Now that the patient is going home, something has to be done in the future. So that's why we're coming back to the present. And perhaps we're talking about the future tense. So Mr. Johnson is now being discharged. The discharge is now happening while you're writing the letter. So it's present continuous. Is now being discharged with advice to follow up with his local GP. So you always follow up with a person and you always follow up at a place. Okay, so with and at are very important, something that everybody makes a mistake in. So Mr. Johnson is now being discharged with advice to follow up at his cardiac rehab center. Mr. Johnson is now being transferred into your care. So with his GP at his rehab center into your care. But the tense that we're using is now being discharged. Dr. Hijab, it should be his HbA1c levels have shown an improvement. That's fine. All right. So guys, if you've understood the tense that we're using and the difference between with, at, and into, and where we use each of them, then please type in yes. Dr. Hijab, if you've understood what I explained, please type in yes as well. And if you have any questions, please ask them now or forever remain silent. Yash, I would try and avoid long sentences as far as possible. So you should write, Mr. Johnson is being discharged with advice to follow up with his local GP. He also has a plan to be followed up at cardiac rehab center. All right. So another thing which is quite important in his follow-up plan or in a person's follow-up plan is the follow-up medications. Okay, so the medications are to be done in the community and it's a future tense. So the way that you write it is that Mr. Johnson would need his medications continued in the community. So it's going to be future would need and continued in the community. You can also write things like, it is imperative that Mr. Johnson is followed up regularly at your practice. And you can also write things like, in order to facilitate a good recovery, Mr. Johnson would need regular follow-up with you. Ikram has asked follow-up 1 week. So if the follow-up is going to happen with you or the person who's writing the letter, you can write that Mr. Johnson would need a follow-up within 1 week or in a week. Or Mr. Johnson would need a follow-up with his GP in a week. Ikram, if you've understood that, please type in yes. All right. So that's how we write the follow-up plan. Would need and things like it is imperative and in order to facilitate a good recovery, and it's always in the community. So very, very important. For people who weren't able to take screenshots, guys, I will upload this on YouTube quite soon. So make sure that you subscribe to our channel. It's by the name of Teach You Academy on YouTube. Make sure that you subscribe to it and turn your notifications on, because we're going to be uploading all of these videos on YouTube. So you should be able to have something in your pocket, especially if you want to revise the same for your just before your OET exam. All right, so that was the end of our session. Guys, we've started uploading PLAB 1 videos as well. So if you're preparing for your PLAB 1, that should be a good head start. You can start watching the videos while you're preparing for your OET so that you start learning about PLAB 1 as well. Another thing that I just wanted to remind you that the group discount will be submitted on the 22nd of July onwards.
Starting on 22nd of August.
The group discount will start from the 22nd of August now. So if you contact Dr. Prashant on +44 7401 554 663, he should be able to enroll you in the group discount for your OET exam. It's about a 30% saving on your OET exam if you book through our group discount session. So it should be very, very helpful to save some money. And if you want to enroll for our one-on-one writing and speaking check, please visit www.teachacademy.com. I hope you guys have learned something new today. If you want to join our Telegram group for people who haven't to receive regular notifications of our YouTube videos, please text Dr. Prashant on the number provided. All right. Thank you guys for joining us today. I hope you've learned something new and you're going to improve your scores on OET. And hopefully, all of you should be able to pass very, very soon. Good luck, guys. And I hope you keep safe.